This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning, Dr. Shakuri-Rad, robotic surgeon and urologist, Mon Health Medical Center. And at this point, he's made enough appearances to be called a friend of the show. Good morning, Dr. Shakuri-Rad. How you doing, buddy?
Great. Good morning, Dave. Thanks for having me again.
You know, we usually ask folks who are coming on the show about their background, education, but you've been on the show a number of times. So I want to ask you, when you get a chance to get away from the office, what's the number one hobby when you're away from the office that you get out to and like to do?
You know, I have two boys, ages 6 and 8. So by default, my hobby is to hang out with them, which I really enjoy. You know, they're in that age where I can take them out, play ball with them, take them to different activities. So that's the part of my life that I truly enjoy outside of work.
Are you able to keep up with them?
Oh, gosh, I realize that, time is sometimes not kind to, your body as you age. So it's, it's getting tough. Those kids have a lot of energy, and I sometimes forget that maybe at the end of the day, while they're still running around, I need a few hours of rest.
Oh, man, if I had that energy now, you'd be in great shape.
That's true.
Well, we're going to talk about robotic surgery, and we've talked about it a number of times, but how did you choose that specialty and start down that path?
You know, when I was in high school, I used to participate in robotics competitions. Essentially, we used to build robots, go to local, national, and international competitions and compete. I actually took Parkersburg High School to one of these competitions, and we did fantastic the first year we participated. I came to Morgantown when I was doing my undergraduate studies and took Morgantown High School to their first ever robotics competition, and we actually won the very first year we participated. And so I was always in that technology kind of field. And when I became interested in medicine, I was also trying to combine my interests in technology, robotics, and urology is always at the forefront of medical technology, and robotic surgery was starting to take off back then. And so I was really interested in seeing how I can utilize my interests in these things and help patients to a much greater degree.
I've got to ask, what kind of robots were you building back in high school?
So you can think of it as battle bots, except the goal of the competitions was to complete certain tasks instead of destroying each other. It was called U.S. First Robotics Competition. It's much more prevalent now. A lot of high schools, middle schools have that. There are some Lego leagues as well that some parents are familiar with. But, it's one of those things that this is how we started getting kids excited about STEM projects, science and technology projects.
It's amazing you're able to combine those two interests, robotics and medicine. So explain to folks, what are we talking about? When we're talking about robotic surgery, what does that mean?
Sure. So robotic surgery is advanced laparoscopic surgery. I compare it to flip phones versus iPhone. So you can make phone calls with both, but that's where the similarities end, right? And so in laparoscopic surgery, we hold long sticks and manipulate them inside the body and manipulate tissue with them, usually inside the abdomen. In robotics, we use more advanced tools and control them from a console that allows us far greater precision, and it eliminates many of the shortcomings of laparoscopic surgery, such as tremors at the tip of the instruments. So if you ever try to lift up a rock with two long sticks, you'll see that, it's hard to manipulate that and actually balance it. And so that's what laparoscopic surgery is. Robotics takes that out of the equation, that kind of difficulty, and allows us to manipulate these tissues much more precisely. Now, during laparoscopic surgery, we also are dependent on our assistants who often hold our cameras and kind of move certain tools for us so we can do a better job with our two hands. In robotic surgery, we have actually 4 arms of the robot that we control, and all arms are controlled by the surgeon. So now you have a 2-handed surgeon become a 4-handed surgeon, which is much more advantageous, especially in difficult situations, difficult surgeries. And many studies have shown advantages such as less blood loss, faster recovery, better ergonomics for the surgeon, and robotics has really taken over, and a lot of fields are getting into it aside from urology. OBGYNs have been using it now. General surgeons are really starting to use it extensively. We have orthopedic surgeons use it, and there are radio commercials and everything. I'm sure people in the community have heard about orthopedic surgery using them. And so I think that's going to be the future is, using these technologies to our advantage and taking better care of our patients. And there is a misconception sometimes that the machine actually is doing the operation, and that's really not true. The surgeon is in full control of all robotic instruments, and because of that, the experience and the hands of the surgeon really matter.
Yeah, I've heard that before. Folks have the misconception that it's like an assembly line robot working on them, but you are there and you are still doing the operation. But there's all these, as you mentioned, some of these advantages, and ultimately the goal here, Dr. Rad, is the care of the patient, the best outcome from the patient, and utilizing these technologies, like you touched on just a moment ago, results in less, I would imagine, less pain. I'm throwing that in there, but less blood loss, quicker recovery times, and again, the end goal being the overall well-being of the patient. Absolutely,
and you're absolutely correct about the pain as well. We have seen in multiple studies that pain is significantly lower after these operations. Now we don't have to use narcotic medications, and with the narcotic epidemic, which was a big deal obviously before COVID started and still is in West Virginia, we don't have to prescribe these narcotics for our patients. They go home on Tylenol and ibuprofen, over-the-counter medications. So I think that's a very advantageous part of this.
Talking to Dr. Shakuri-Rad, robotic surgeon and urologist, Mon Health Medical Center. And when we come back, we'll focus in on how robotic surgery can be used advantageously, in particular in the field of urology. We'll do that next as Mon Health Talk continues on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Shakuri-Rad, robotic surgeon and urologist, Mon Health Medical Center, is our guest this morning. And Doctor, you've been recognized as a master surgeon and surgeon of excellence. How does one achieve that designation?
So any hospital, can purchase these robotic tools, but we have a center of excellence, and a center of excellence accredited hospital has been vetted by external review boards and found to function at the highest level and offer the safest, most effective surgeries for their patients. It also means that we have trained staff, starting with experienced surgeons, assistants, OR staff, and nursing staff. This allows for overall, better outcomes, quicker recoveries that we just talked about. And our accreditation was obtained through the Surgical Review Corporation, which is a nonprofit patient safety organization, and they develop and administer best-in-class accreditation programs for medical professionals, surgeons, and hospitals throughout the world. And they stress that excellence is not simply, just an achievement. It is a culture that must be sustained. And that's exactly what we do at Mon Health, and what we are known for in the community. Our robotic surgery program, which includes general surgery, urology, and soon benign gynecology, was the first to receive this accreditation in the region and has remained the only one in North Central West Virginia. And so as a master surgeon, the master surgeon title is essentially a designation given to surgeons who have extensive experience in their field and have consistently shown superior outcome results. Master surgeons, surgeons of excellence, these titles have been given to surgeons who have lower complication rates, have shown increased patient safety, and mastery in their field. So I was really blessed and very fortunate to work with a team that allows me and the hospital to get these accreditations.
I said before the break I wanted to talk a little more in depth about how robotic surgery is used specifically within urology. So I guess the broad question is, what types of procedures and how do you use robotic surgery when it comes to urology?
Sure. So essentially, any surgery that used to be done open, where we made big incisions in the patient, I can now do robotically. And I treat a lot of urologic cancers. For example, I treat cancers of the kidneys, ureters, bladder, and prostate with robotic surgery. I'm also one of the very few that offers outpatient surgery for several of these cancers now. And what that means is that patients can go home faster and recover in the comfort of their own home and environment. Most of my patients also don't require narcotics, like I mentioned before, which is a very big issue. I would like to stress that the gold standard treatment for both prostate cancer and many kidney cancers is robotic surgery. Often surgery can be curative, as one of my patients was recently recorded to say, how often can you have an outpatient surgery after a cancer diagnosis with a chance to be cured? So this is really, this robotic surgery has revolutionized the way we treat patients. And not all patients are, of course, candidates for surgery, and we always discuss the risks, side effects of all procedures with them before they make a decision for treatment. But more importantly, at Mon Health, we offer a comprehensive cancer program aside from robotic surgery. And we have a multidisciplinary team consisting of medical oncologists, radiation oncologists, surgical oncologists. And so patients really get that comprehensive care we all look for. And robotic surgery really is a tool that we use in this comprehensive medical care.
That is amazing to me that we're talking about a possibly, a cancer surgery, and it could be done in outpatient. You could actually, and you can correct me if I'm wrong, go in the morning, have the surgery, and by that evening, if everything goes well, you could be back at home. That is amazing to me.
Yeah, and it's when medicine has come a long way, surgery has come a long way, and I'm always blessed to be in the middle of it and experience how things have progressed to the point where now we can give really good news to patients for very scary diagnoses, just by the fact that these technologies, these tools are allowing us to do a better job as physicians, surgeons, and medical professionals.
What other types of outpatient procedures do you offer?
So I also perform minimally invasive surgeries for kidney stones, the UroLift procedure, which is designed for enlarged prostates or BPH for men who have urinary symptoms. Actually, one of the only surgeons in the region who carries a Center of Excellence designation for the UroLift procedure here. I also perform the Interstim procedure, which is a sacral neuromodulation procedure for patients that have urinary leakage, essentially symptoms, and so their bladders aren't functioning properly. I was the first in West Virginia here recently to implant the most advanced bladder stimulator called the Interstim X this year, and that was very exciting for us in our department. In addition, I also perform prosthetic surgery for patients who have advanced erectile dysfunction, and those surgeries really all are minimally invasive, and my goal is always to offer something where I can do the most good and get the patients home the safest and the fastest.
You mentioned Interstim there briefly. Can you talk a little bit more about what that is? And you mentioned, I think, first to do it in West Virginia, the significance of that?
Sure. So Interstim is essentially a bladder stimulator. It's a sacral neuromodulation device. It's a small battery that controls bladder function. It was patients who suffer from urinary urgency or incontinence that has been refractory or non-responsive to other treatments are great candidates for this. There are also patients who suffer from fecal incontinence, so bowel symptoms, or urinary retention, not being able to empty the bladder at all and requiring catheterization, who qualify for this procedure. And this procedure has really improved the quality of life of a lot of patients who otherwise would be dependent on things like catheters and diapers, essentially, to get through the day. The Interstim X is the newest device in this category, and it has a battery that we can install that lasts upwards to 15 years. So essentially, in a lot of cases, even for the rest of the patient's life. So this has been really a revolutionary technology. It's been offered for some time now, but again, like any other technology we just discussed, like robotics, the technology keeps getting better, which allows us to do a better job as surgeons.
Dr. Shakuri-Rad is our guest, robotic surgeon and urologist, Mon Health Medical Center, and we'll wrap up our conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Shakuri-Rad, our guest this morning, robotic surgeon, urologist, Mon Health Medical Center. And Dr. Rad, if folks have been listening, what's the one thing you want them to take away from our conversation this morning?
I think the most important thing, we always talk about these treatments, these advanced treatments, but these treatments are really not useful unless patients get tested and get screened. So I think the most important thing and the most important message I have to give is that, you need to get screened, and you need to listen to your family physician and screen yourself for the various different things that we recommend, such as prostate cancer, colon cancer, kidney cancer. All those things require screening. If we can find these illnesses early, we can often offer curative treatments. But if we kind of let it go and things progress, then that's when we as physicians and healthcare providers have to give bad news. So if patients simply get screened, then I think we can have much better outcomes, healthier communities. Guidelines change all the time, and so listening to your physician is really, really important. And me being in urology, I treat a lot of men, and us men are especially stubborn about, getting any kind of health care or even listening, to anybody, unless maybe our spouses, push us to do it. And so I think it's important, take care of yourself so that you can take care of your family and your loved ones.
Dr. Rad, always enjoy the conversation. Good luck keeping up with those boys, and thank you for the time this morning.
Always a pleasure. Thank you.
You can always get more information at monhealth.com/surgery, and, of course, the Mon Health Facebook page as well. That'll do it for Mon Health Talk this week. We'll be back next Monday with a different topic and guest at 8:35.